A lot about the holidays coming. Halloween is just about here. Next thing you know, it's going to be Thanksgiving, then Christmas, and then the New Year. So what do you need to do to keep your health on track before 2020 gets here? Our expert, Dr. Cedrek McFadden, is here to tell us that the time is now to take some important action. So what do we need to be doing? We need to think about screenings, right?
I think we should. I mean, if you think about it, we are less than 70 days away before the end of the year.
Wow.
And most of us have had a year that's busy with our families. It's a great time to pause, think about the things we've missed, and take this opportunity to get some of those important tests that we need to get done.
Is this a good time of the year to get in with doctors? I mean, timing-wise?
So it is a busy time of the year because a lot of folks have the same idea. Folks have met their deductibles, they've met all of those copays, and so they're looking for ways perhaps to save some money with some of these tests. So it may be a little bit harder just because of the increased volume that are coming to the offices right
All right,
now.
but if we're going to do it, we need to get on the phone, and what should
Today.
Today. And what should be the #1 test we try to get done?
So I think the #1 test, if we're talking about screening for colon cancer, screening for breast cancers, we've talked about male breast cancer before, taking a minute to take a look at the tests such as colon cancer, having a colonoscopy, talking with your doctor about having that important test that can find these cancers when they're early, when they're able to be treated sooner.
And what other tests should we consider and make sure sort of our priority list of things to get done?
So colon cancer, breast cancer, prostate cancer, even cervical cancer. Each of these screening exams come with certain groups that should be tested. Men over the age of 55 to 69 should be screened for prostate cancer. Females over the age of 21 should get pap smears. Women over the age of 40 should get yearly mammograms. These are tests that should be on your radar this time of the year.
And so when it comes to those age groups, are there people that kind of neglect it because they are younger? They think, oh, not me, I'm fine.
Well, absolutely. If you don't see a problem, you don't think there is a problem. And that's why it's important that #1, before you even get to your doctor, you're paying attention to your own health, doing monthly exams, paying attention to changes that you see that weren't there before. Those are things you should be doing.
So listening to your body and the signals that it's sending to you?
Absolutely. And actually taking the opportunity to speak with your doctor about the things that do concern you.
And when it comes to family history and these screenings, I mean, if you have any history of this stuff in your family, these screenings should be like really popping on your radar.
Well, because in some cases, having a family history, say of prostate cancer or breast cancer, may increase your risk of having other types of cancers, which is important to know your family history, talk to your family, and actually talk with your doctor about these histories as well.
All right, to the ladies and gentlemen out there who are like, I'm too busy for this, I don't have time, you know, life's too busy, please wake us up.
So we can actually cure and we can actually treat many of these cancers if we find it soon enough. And so I can underscore the importance of finding out early whether or not any of these diseases are present. That's by having colonoscopies, mammograms, having the prostate exams, and even having the pap smears.
Do you meet patients who are just like, I just don't want to know? Like people who refuse to do the screenings and they wind up with an advanced situation because they just didn't want to know?
Well, a lot of it's fear. People
Right.
fear the unknown, and a lot of that fear is related to misunderstanding of what actually is present in the treatment process. Folks come into the office say, I don't want colon surgery because it means I'm going to have an ostomy or a colostomy. That may not be necessary. So it's the fear of the unknown that holds folks back from getting those important tests.
And sometimes making really wrong assumptions, right?
Absolutely.
Because I mean, even with breast cancer, I was at a breast cancer event this week and they were talking about the advancements now that in many cases you don't even have to do chemotherapy. And most people think that's going to be automatic.
Which is why it's important to talk with your doctor, bring up these conversations. Hopefully your doctor's bringing them up with you, but having these open dialogues, and that can actually be helpful in you getting those tests that you need.
Well, we hope everybody gets their screenings, Doctor. Thank you for being here to remind us.
Thank you.
Appreciate it. You're watching Carolina's Family at 4. We're coming right back.